We're going to actually talk about stockouts today. Medical supplies, supply chain management in hospitals are seeing a lot of issues like stockouts. There's wastage, expiring stock, and clearly there's just over ordering that's taking place. How can you actually solve for that problem is what we're going to actually review in this webinar today. There's lots of financial strain on both providers and patients that's causing great impact to care. Rising costs are actually there because of workforce shortages, pharmaceutical supplies, and supply chain issues. Medical supplies, in addition to labor costs, is actually one of the two largest problems that are being faced, as you probably know. The supply chain teams and the clinician teams are struggling to get the right inventory at the right place at the right time. What do they need? They actually need real-time visibility. They need automated reordering and very clearly, very high accuracy on which these orders are placed. How serious is this issue? This is such a serious issue that 25% of all the healthcare spending goes to waste. There are over 30% of over-ordered medical supplies sitting on shelves and expiring every single year. 35% of clinician and supply chain management people's times are spent on counting. Can you believe that? That should be more like, focusing on patient care. And what are they doing counting and ordering and counting and ordering and that too, not in a very, very efficient way. And nothing has really changed in healthcare for the last 40 years. If you come to think of it, you've had many technologies out there, and God bless those technologies. I mean, there's absolutely great stuff there, but nothing has changed in the last 40 years. It's definitely not helped with the ordering and the counting problem that causes these levels of issues. What's really needed is real-time visibility, no human error, no theft, no wastage, clearly, overcoming any shortage of clinicians and supply chains who are actually spending a lot of time to actually manually count this. I call this a 75% problem. So what is a 75% problem? The problem is that when you actually go to any hospital system and you see how much of supplies they have, medical supplies, they want to be in a never run out situation. They never want to run out of stock. And so what are they doing? They're actually over ordering items. Now, no one likes to over order. They just have to order more than what they need because they can't see what is the real time stock situation. And because a result of that, they are not counting. Again, there's paucity of time. There's, clearly not enough people to count. So they go by opinions, not by data, not by facts, and they end up over ordering. The risk is not over ordering and actually having more than you need on the shelf. The risk is under ordering as well. And if you end up over ordering, they expire. There's theft, shrinkage, and wastage. But if you under order, the item is not present when the patients are waiting for it. So you clearly have to have every shelf with the right size inventory and not either over or under. Now, our solution works on moving the over ordering into the right optimum band, in the right ordering band, and moving the under ordering also to the right optimum band. You have to have the right product, the right medical supplies at the right place at the right time. It not only helps with improving the financial performance of that particular hospital chain, it also empowers your teams to meet the unit economics, the budgets that are needed, and more importantly, provides for excellent patient care. What was the problem that was presented to us a few years ago? The problem was that clinicians, when we met the hospitals and the clinicians and supply chain teams, they said that, look, this is what we want. We want the nurses and clinicians to run into the inventory room to fetch what they want. And automatically, just by magic, the room should be intelligent enough to understand what the inventory position is, and it should be able to reorder. Once it's reordered, the stock gets replenished, and you should get critical demand forecasting insights. Insights like, oh, how much has been consumed? When was it consumed? What was consumed? What do we need to do to reorder? So this was supposed to be done with zero human touch. And the zero human touch is extremely important because no one wants to create technology or deploy technology for the sake of it. You need technologies to adapt to the clinician workflow, to the existing processes, and not actually trying to change any process or change any workflow or get humans involved when you don't have to. So the solution was to actually walk right in and put Chooch cameras on the existing racks. whether they are metro racks, high density racks, Kanban racks, louver racks, acrobin, panels, covered carts, uncovered carts, any sorts of shelving types. We just go in and we actually install our AI cameras on these particular racks that make the racks intelligent. Once the racks become intelligent, you can see out here, the AI detects the inventory signals. When it detects that the stock is low, it sends an automated demand signal to reorder. Once the reorder takes place, you get these critical demand insights. Let's see how it plays out on a video out here. These are nurses and clinicians that are running to the inventory rooms to gather what they need. And there's a clear skew association with the inventory dashboard, which actually shows how much is actually being taken and how much will eventually get consumed and how much actually needs to get reordered. Let's play this video for you once again. It's as simple as the cameras are having a top-down view in this case. They're looking at the inventory position. Once the inventory goes low, the camera detects, sends a demand signal. It logs into the system. All of a sudden, you actually are now receiving demand signals to reorder. Install, deploy, turn on the system, reorder. You have an automated counting solution here. You have an automated reorder solution here with zero workflow changes, zero operational disruption, and no manual dependencies. Is the solution unique? Yes. Why? It's not only the camera that is actually getting you your visual inputs. We also have a multimodal sensor, which is the camera has got an audio input device. It has a microphone. So the nurse walks up and actually decides that, actually looks at the inventory position, doesn't find the stock. The nurse can speak into the camera and say, where can I find this? And it'll tell you that 3 floors up, 3 doors down, you can actually see it. You can actually get it. And when the nurse goes to that new room, because it's a new room, and the nurse does not know, the LED that's in the camera switches on and actually points to where the items can be retrieved. So let's walk through this. You can actually talk to the camera, you can write to the camera, you can look at a camera, and all of a sudden, you actually go through the entire automated workflow, almost like how a human would. A human can see, a human can hear, a human can speak. So you're making the camera a digital assistant, a digital storekeeper, a digital bot with the advanced agentic AI that we're putting out there to create an autonomous AI solution for healthcare. But the technology advancements continue. I don't want to tell you that this is a once in a lifetime opportunity to change and the technology has been created. We will continue to create better AI models that are able to actually detect, understand the context, and of course, send signals to reorder, but also not only signals to reorder, but also provide the necessary demand insights and forecasts as needed. It is the most inexpensive solution in town. How do you get a feasible technology solution at an economically viable price point? We do this because AI, once the models have been created, they can be used and reused, and they're very repeatable and extremely scalable. And if you look at this is a typical hospital environment. For every dollar that they're putting in the technology, there's at least a 3.5 to 3.75 return on a conservative standpoint, but more of 5x to 7x return on an aggressive savings basis. And again, it's a function of what the hospital is, what the environment is. It's very specific, it's very unique to your environment. Right sizing inventory with real-time visibility yields to these kind of results. Let's actually look at these charts. I'm going to actually play this back to you once again, but let's see what are we going to look at. If you look at an empty bin, you want to make sure that the empty bin, which is the dark blue, which is actually playing out here, continues to actually go down to zero because you do not want less stock. You do not want critical stock. You definitely don't want no stock. So if you are on a critical stock level and you're in the empty or the 0 to 25% band, watch out for these two colors, the dark blue, which is out down here, that I'm going to actually show you. And then, of course, the red, which is also down here. So you have to reduce the empty and the overfill over time so that you don't have any actually empty or actually overfill situations. You also don't want any critical stock situations, and we're going to actually look at that as we speak. You want to move more of your inventory to the right inventory band, which is the 50 to 75% or the 75 to 100%. So you want to have more of the blues You want to have more of the purples out here. You definitely don't want more of the overfills, so watch for the orange band as well. So in short, blue is bad, red is bad, orange is bad. Green is kind of bad, purple and blue is good. Let's play that again for you. Look at the purple and blue, that's good. Excellent. We're getting more of those. And look at the other bads. Well, we're getting less of those. That's exactly what the intended, results of the solution should look like. This is another chart to show you that. So this is the overfill consumption chart that's actually going and trending down to the right levels of inventory over time. Now, a lot of folks would come back and tell you that the savings are instantaneous. They're not. That you'll get to the right inventory models tomorrow. It won't happen. It is a collective effort of the supply operations team, the clinician teams, to tell you what the right min maxes are. And based on the right min maxes, you can decide how many inventory turns and how much of inventory do you need. So it is a comprehensive digital transformation exercise where you get in and you actually reestablish what are the levels of ordering we have today and what are the levels of ordering that we should have tomorrow. Let's go back to the results once again to see this was not created due to any level of magic. This was AI guided by human intelligence. And AI guided by human intelligence is where you actually see the bad and you reduce the bad. You see the good, you enhance the good, and you move to more inventory, optimum levels of inventory. That's the only way to reduce stock. It's the only way to reduce stockouts. It's the only way to eliminate manual workflows and clearly get to the right inventory at the right place at the right time. We have an inventory control tower. This is a typical snapshot of how a dashboard looks like. I mean, so this is a rack. I remember this to be a Metro rack, and the Metro rack has got about 89 products in it, unique SKUs. This is what it's showing at this point in time. There is, very little overfilled, as you can see here. More than 75% of the items are in the low stocks, medium stock, or the high stock situation, and there's nothing in the no stock and the critical stock. So a typical dashboard gives you the view of a rack. You can click onto any of these items and you can get into the stock by stock position, the hour by hour consumption model for any of these racks. So this is how a typical rack looks like. For a particular item, it gives you the ability to look for low inventory, which becomes a focus area. You can even set up rules which says that, oh, every time a replenishment takes place and it's still low inventory, give us an alert. And it shows that, oh, even despite the replenishment, we're still running low stock, which means you have to readjust the min maxes. Clearly, you don't have the right, metrics or actually variables or the sizing of your inventory that needs to be corrected. You also get to look at the product, the SKU name, the location with input count image to validate. You also get a full time-based usage of how much was used, when it was used. And you get this stored all over the days, weeks, months, years. You get another view as well, and we call this smart analytics in the inventory control tower. This actually looks at filters. You can actually put things like which are the items that are continuously low stock every time, which are those which are continuously high stock every time. In fact, one of our clients, it's interesting, 35% of the products on their shelf were not used for 2 years. And now they could get that insight and they could figure out, why are we even ordering that items? I mean, it's just getting overfilled and it's just lying there. It's not being used. So, we get those level of insights. You can also actually look at the turnover of the products. High inventory turnovers, medium inventory, low inventory turnovers, which products are used, at what times of the day, which departments actually are keeping to budget and which aren't. In fact, we also had another situation where we had the clinicians fighting with the supply chain team saying you did not stock. And the supply chain team said, well, we did stock, but somebody from the clinician departments came and took a lot of stock and they just took it up and they put it in their drawers. And there was again no end to that fight. And obviously with a system like this, they went in and they were able to actually look at the images. What was the stock position at what point in time? What time did the stock immediately deplenish and actually at what point in time was it replenished? What time did it deplete? What really happened to the system? You can also do back orders and purchase order references. And this is, again, a small snapshot of what the inventory tower is. It's almost like, for folks who have watched Star Trek and Star Wars, Mr. Spock says to Scotty, Scotty, beam me up. And Scotty beams up Mr. Spock to another planet or Captain Kirk for that reason. You can get the opportunity to beam yourself into any control room, into any rack, into any SKU of your choice to see what's really going on. That's what the live inventory control tower is. The autonomous solution has got many, many downstream benefits. Some of our medical hospital system clients are looking at us from a real estate optimization standpoint. They actually tell us that, which is right, that hospitals are in expensive zip codes. And when hospitals are in expensive zip codes, you want to make sure that the real estate is going more towards patient care, active patient engagement, rather than stocking inventory. So this actually platform is also used to do real estate optimization to optimize how much of inventory in how many bins in how many locations. It's also helping with supplier economics. You can do, supplier sourcing. You can do events to find out, what kind of contractual needs do you have? The spend visibility helps you actually get your right budgeting exercise and the analysis in real time of capturing what your needs are. You can get into demand forecasting. In one particular hospital, oh my God, we will give them, 500 billion data points a year, every year to actually make the analysis and get the automated analysis and insights on how many suppliers, what kind of trends, what kind of consumption, the entire spend visibility and demand forecasting. From a governance standpoint, you can look at supplier risk and performance. From a collaboration standpoint, you can again set up, sourcing events and collaboration. Productivity is an extremely improved state because there's zero disruption in operations, there's zero change management, there's zero training. No one is now being trained on how to barcode scan or weigh items and look at those signals, or even actually manually count them. Whether it's a box, a pack, a roll, a case, or eaches, you can actually have this technology deployed to count as needed. You also get into a very interesting situation where you can reduce overtime. You can reduce overtime of people, last minute order changes, and clearly, you can move into vendor managed inventory. You do this for financial gain, we see that. You do that for unit economics, we see that. You see all of that, but most importantly, you do this for clinicians for the right patient care. This is what the clinicians have been saying to us. They're actually seeing the difference. It's clearly a patient first technology. Some of the clinicians have come to us and said, this is fantastic. We didn't have stock in our inventory room. We had to actually go to other stock inventory rooms that are not ours to actually fetch the items. Some of the clinicians came to us and said that, look, I'm so glad that we have something like this. I have my office drawers filled with medicine because I don't trust that I will have the right product medical supplies when my patients show up. Another clinician walked up to me and said that I did not go to medical school to sit down and barcode and count and scan. That's not my job. My job is patient care. And thank you so much for actually helping us out. Some of the clinicians came back to us and said that the room looks so clean and organized now. I know I will find the stock when I look for it. Some of them came back and they liked the fact that they could talk into a camera and actually walk up to the next room and actually find the items. People love the idea that the cameras have LED lights that actually, switch on and switch off. They call it as a Christmas tree event that takes place in their inventory room every day while the cameras are taking the stock position. So lots of very, very good feedback that we're getting. And again, just the fact that we can make a difference in the clinician's day makes a whole lot of difference to us. Unique to your environment. This is not something that we've actually created by ourselves. We are very, very honored to have partners like Microsoft, and we're part of the Pegasus program. We are also NVIDIA's Inception, Launchpad, and Metropolis partners, Intel's partnerships, and of course, with the likes of a Deloitte and an EY, working very closely with the Ericssons and the Intels of the world, we have been actually trying to co-develop this solution. We're very, very inspired and excited about the opportunity that's actually presenting ourselves. There are more than 24 health systems at this point in time that have actually shown a lot of interest. IDNs, hospitals across the world are reaching out to take advantage of the solution. And we feel very privileged and humbled with the opportunity to actually be the technology provider of choice.